Perfect. So I'm Dr. Naomi Maynard. I lead Feeding Liverpool. That's the City of Liverpool's Food Alliance. We've been going since about 2015, so quite a while now. And one of the things we're doing here is driving forward Liverpool's Good Food Plan. This is a strategic plan for the city, which we've developed in partnership with many people on this call, as well as colleagues from the City Council, NHS providers, the university, lots of people from the voluntary sector. The vision behind this plan is for everybody in Liverpool to be able to eat good food. We've still got a few of you coming in today, so do pop your name in the chat as you come in, and welcome. And please, as I said, this is being recorded, so do keep yourself on mute and turn your camera off if you'd rather not appear on the recording. So today's event, the focus today is on sharing the research findings of a report that we launched last week, which is called A Healthy Start for Liverpool. You'll see we've got a kind of shorter executive summary and a longer report, which goes into a lot of detail. We're really grateful to have Rachel Flood here today, who's kind of led our work on this report, and she's going to talk us through some of the findings. We'll also then hear from a few of our local partners who will share their kind of reflections on the recommendation, which you'll see in the report. So this event itself doesn't go into detail about the mechanics of Healthy Start. If you're someone who's very new to Healthy Start, we are going to be having a couple of training sessions, one in October and one in November, and the details will be posted in the chat in a minute by my colleague Genshin. Those sessions will really focus on what is Healthy Start, who's eligible for it, and how you can support someone to sign up. Whilst today's session is focused on the recommendations on how we can improve the uptake of Healthy Start, particularly in Liverpool, but also some national recommendations, what could be done better across the country. As I mentioned, my colleague Genshin from Feeding Liverpool, she's going to be posting lots of links in the chat. So do keep an eye on that chat for things that might be really helpful, other websites about Healthy Start, and ways you can sign up to our training and where you can read the report. So she'll be posting links in the chat during this next kind of hour. I think I mentioned at the start, it is quite a short session. So Rachel and I might not have time to answer everybody's questions. We will do our best to get to them, either in the chat or I as chair will kind of bring in Rachel at various points when we've got kind of time in the schedule. But please do get in touch with me afterwards if there's something kind of specific you really wanted to know a bit more about. So I think I wanted to share with you, before we hear from Rachel, a little bit about why we chose to focus on Healthy Start this year and what we at Feeding Liverpool have done. So from a personal point of view, a few of you will have read the forwards that I wrote within the report. Healthy Start is something I've really benefited from. I had my first son 8.5 years ago now. My husband and I were both students, and being eligible for those Healthy Start vouchers, they were paper vouchers at the time, just really eased our household budget. It meant we were able to buy fresh fruit and vegetables at a time when we might have been compromising on things like that. So personally, it's something very close to my heart. But professionally, as part of Liverpool's Good Food Plan, we're really passionate about improving access to good food in the city. And we know from some of that national research that when families are part of the Healthy Start scheme, it does increase the amounts of items like fresh fruit and vegetables that they're able to have in their diets, and really helps give our children the best start in life. For us, Healthy Start became a priority area as it was an area we could focus on in this first year of the Good Food Plan without necessarily asking the government to commit more funding. The funding for Healthy Start is already ring-fenced for eligible families. We just need to support more of them to know that they can claim this money and understand what the scheme is. I think during the cost of living crisis at the moment, increasing the uptake of Healthy Start feels like a really easy win. It's something we can do to improve the food insecurity of some of our lowest income households. In Liverpool, as I'm sure many of you from across the country will know from your own kind of localised statistics, uptake levels of Healthy Start really fluctuated over the years. So peaking at kind of 80%, I think that was when it was introduced, but Rachel might correct me a bit later, being as low as kind of 1 in 2 who were eligible were missing out on the scheme. But any eligible person who should be able to access Healthy Start but doesn't know about it or has struggled to apply, so hasn't, is 1 person too many. So at Feeding Liverpool, alongside this important piece of research, we have also undertaken a process to raise a bit of local awareness about the Healthy Start scheme. So you've got some pictures on the screen of some of our wonderful new community Healthy Start champions. So back in May, we ran a couple of training sessions. These are mainly with volunteers from food banks and from community pantries. We've got a couple of them on the call today. Thanks for coming, guys. And people came along, they learned about Healthy Start. For the majority of these 80, it was for the very first time. And they've then gone back into their community food spaces and been champions, advertising the scheme, supporting people to sign up from it. And if they're a community pantry or a community kind of market, potentially accepting the Healthy Start cards as well. So it's been brilliant to have that side of kind of Healthy Start be focused on raising local awareness. More nationally, we've also been part of a coalition of charities calling for changes to the scheme. So supporting the work of charities such as Sustain, but also Feeding Britain, who will have a short video from their director a bit later on in this session. So without further ado, I'm going to hand over to Rachel Flood. Rachel's going to take us through some of the key findings and recommendations from the report. So thank you, Rachel.
Thanks, Naomi. Good morning, everyone. As Naomi's already said, we've kind of pitched this assuming that the people who are in the room are those who are aware of Healthy Start. So I'm going to jump right in really and provide a bit more context for the research. So what we did, looking at what we found out and what some of our recommendations are as a result of our research. So if we just move on to the next slide. I've just put this slide in for a little bit of context really in terms of what, why we conducted the research, because Healthy Start itself has been in place for over 16 years. But when you start to look a bit under the surface around a lot of this, you can see that there's just still, despite the time it's been in place, a lack of understanding about the scheme. There's a lot of confusion still over eligibility, and all of that just leads, inevitably really to resulting in a lot of significant inconsistencies really in how the scheme's coordinated, within Liverpool particularly, because that was our focus. As Naomi said, take up of the scheme has fluctuated quite significantly. Nationally, it's been on the decline really since 2015, down from 73% to 51% a couple of years ago. The last time data was available, which was March 2022, there was 73% accessing vouchers in Liverpool. So that was either in the paper form or the new digital voucher. So you can see it slowly ticked up in Liverpool to 73%, but you can see that it has been very low as well in the city too. We've had no further data since the introduction of digital, but the feeling is that the take-up is going to have plummeted. In fact, The Guardian did an article about, I think it might have been in June, where they estimated that there is about 52,000 existing beneficiaries of Healthy Start who've been unable to reapply. So if you add that, this kind of, the fact that there's a number of people, this patchy take-up to the many other eligible families who've never applied, then you're starting to see that it's amounting really to a significant lot of money that isn't flowing into our city and to the homes of some of our poorest families. Research from Sustain nationally has found that over 2 million eligible families missed out on Healthy Start, and that literally resulted in a £69 million loss to families and those local economies. In Liverpool, we estimate that that figure is going to be around £750,000, of about £750,000. So all of which means that if you take all of that together, the government spending now considerably less each year on Healthy Start, because you don't automatically get it, you've got to apply for it. But if you don't know about it, you can't get it. So we're spending a lot less. It's now estimated that the government's spending about 50% of its original budget. It's also reaching far fewer beneficiaries than anticipated. And the reasons behind that are probably for a lot of the things that we're going to highlight in this report. I don't think these are just, particular to Liverpool. So if I move on to the next slide and just talk you through some of our research aims then. So given the context, Feeding Liverpool's research, kindly funded by the Torus Foundation, was focused on understanding how existing beneficiaries and frontline professionals are currently viewing the scheme. We wanted to try and uncover what the barriers were around why the take-up in Liverpool wasn't at 100%, why there was, I mean, at the time we thought it was about 2/3 of families were accessing the scheme, so that was 1/3 who weren't. And we wanted to try and understand what some of those barriers were and any solutions we could come up with to try and address that. To help us to answer those questions, we visited 5 children's centres across the city. We designed a questionnaire which we left in those children's centres. We held 2 focus groups, one with health visitors and one with the voluntary and community sectors, to try and get a sense of their understanding of the knowledge and awareness of Healthy Start. And we also interviewed a number of colleagues within housing, public health, the Citizens Advice Bureau and the local authority. Added to that, we also made sure that we tried to find out what the best practice was nationally. We were really keen to understand what other areas were doing. So we brought all of that in, particularly around the vitamin element as well, because we appreciated that that was one thing, not just in Liverpool, but around the country that wasn't particularly well used. From all of this, a number of key messages started to emerge, and we've grouped these together into like 5 key headings, which I'll walk you through now in turn. So if we go to the next slide. In terms of parents and carers, I think, you know, the parents and carers we spoke to when we visited children's centres, most of those said that it was easy to apply once they knew about it. And the transition to digital as well hadn't really been a massive issue for them either. There was a general understanding about the benefits of the scheme and what it was trying to achieve. And parents were saying things like, you know, to give our kids at least 1 a day, to get them access to fresh food, to make it easier to get healthier food. So they were kind of aware of what the broad aims of the scheme were. However, that understanding didn't really translate to the rest of the scheme. And to be blunt, I suppose, and this wasn't just with parents and carers, this was across the board. There was just really a general lack of knowledge and awareness of the scheme. For parents, for example, there was confusion over whether you can, when you can claim Healthy Start, with lots of the parents that I spoke to not being aware that they could have got access to that scheme when they were pregnant. Others didn't know how to use the digital card. So, for example, some parents didn't know that they could actually use it at an ATM to check the balance. They didn't appreciate that the money rolled over now, unlike on the paper vouchers. And for others, it was for those who had access to the scheme when they were pregnant. I think one of the big things for me was that it wasn't always clear that they needed to inform someone once they'd had their baby. And if they didn't do that, then they would fall out of the scheme again. So that was a bit of a barrier as well, as was the internet. This was reinforced as well by frontline professionals who commented that a lot of families were finding it difficult to not only access the internet, but to have either the resources or the funds to do that, if you're talking about smartphones and just trying to use that digital. So digital kind of exclusion came up quite a lot. They also referenced frontline professionals around families that a lot of the times families would bring the paper voucher to children's centres, and then that children's centre worker would sit down with the family and help them to apply. I'll pick this up later because that's been one of these unintended consequences, I think, around the move to digital, is that that's a lot harder to do when children's centres aren't geared up with ICT to be able to sit parents down at computers and do that kind of thing. So that they were the barriers for parents and carers. If we just move on to the next slide. For frontline professionals, I think without a doubt, professionals were incredibly passionate about Healthy Start in the city. But I can't deny that levels of knowledge within those professionals did vary greatly. With things like some not knowing that you could apply when pregnant, others not knowing that, about access to, for those with no recourse to public funds, also potentially being able to access the scheme. So without exception, with every member of staff that I spoke to, they all said they'd welcome some kind of training around Healthy Start, as they felt like they were finding out about it almost in fragments, and often from parents themselves. excuse me, there was also limited awareness really of the national resources that were available, so that the website, that they could go on there, they could print off Healthy Start literature, which they could tailor to their own local facilities. So there was limited awareness of that. There was also really limited awareness, I think, around the vitamin side of things and the scheme in general. One children's centre worker said that there was a parent within their scheme who was entitled to Healthy Start, but didn't take it up because they thought at first that for them it was only for vitamins. So they didn't understand the scheme more broadly either. Another health visitor commented on how families are just that overwhelmed at points when you're trying to provide them with information around Healthy Start that it almost gets missed. So she said that even though they constantly remind families that it needs more of a concerted, coordinated effort from everyone who comes into contact with children and families who may be eligible for the scheme, constantly just repeating those messages, hoping that at some point it will land for those families. But for health visitors, it did feel like they were trying to get across a lot of information all in one go. And sometimes that might be the bit that kind of misses, doesn't land with families. All frontline professionals also referenced many parents and carers who they knew who were eligible for Healthy Start, but were subsequently turned down. So they said that they'd welcome some more support with really challenging some of those issues, or help with some of the more complex cases. I think all of this, I suppose, just goes to suggest that the issues for Liverpool around take-up are not necessarily that parents are not wanting to access the scheme. I think it's perhaps more that they either don't understand what the scheme is and what they can use it for, or they don't know about it, or it takes too long to apply. There's a number of things all swirling around really that are preventing parents from accessing the scheme at this point, but a lot of which can be helped to think through some of the recommendations we're going to highlight in this report. The final thing from frontline staff was that there was also a bit of a concern around that there are parents who say attend children's centres who are eligible for Healthy Start, who are then also entitled to a number of other additional things such as Alexander Rose vouchers. And they were finding that actually the people they were more concerned about and the people they felt were more food insecure were those who fell just outside the threshold to qualify for Healthy Start. And they were wondering and wanting to see what more they could do, with some children's centres even tailoring now at some of their more discretionary items, focusing them more on those parents and carers who didn't currently receive Healthy Start or Alexander Rose vouchers, because they were the ones they were very worried about. If we move on to the next slide. In terms of this, then, this is kind of starting to think a little bit more around some of our recommendations now, but key messages from this, from all of the research that we've done around this, best practice really suggests that Healthy Start is most effective when it's owned by someone who acts as the lead and coordinates all of that effort, and is supported through a multi-agency steering group of senior staff who can get things done should things need to be done. Currently within Liverpool, Healthy Start is no one's job, and I think that has led unintentionally to the situation we find ourselves in now. And basically that situation is one where it's almost an element of potluck around which children's centre you might arrive at, or which health visitor you speak to, around whether you get all of the information, the correct information, you're given access to the leaflets, all of that kind of thing. So there's a lot around that we need to do to just generate a bit more consistency around that approach across the city. Within Liverpool, I think our research also found, and we found this quite early on, these key messages were things that we developed it was within the first week. These messages were really loud and clear, is that the lack of this person in post, this absence of a role, was hampering really any efforts to increase uptake. As I've already said, there's a great deal of passion for the scheme amongst professionals, many of whom would like to do more if only they knew more. And again, this lack of consistency around information that's given out, knowledge and awareness of the scheme, inevitably has meant that many eligible families have been missing out. All frontline professionals, again, we spoke to, agreed that it would be easier. They would welcome someone picking this, this role up. And this is our #1 recommendation, that we would recommend that there is a Healthy Start lead for the city. It's a clear gap, but we think that with its introduction, we could quickly support a much more coherent and coordinated approach and a response to, particularly around the vitamins, and trying to increase that uptake as well. Okay, if we move on to the next one. Findings then around training and workforce development. I think the knock-on effect of everything I've said so far has just mean, because Healthy Start isn't owned, that's directly affected people's knowledge and awareness of the scheme, and any changes to the scheme as well, like the move to digital. So many frontline professionals, for example, around that move to digital, were telling me that they only found out about it when families were coming in with the card. Up until that point, they didn't know. And why would they? It's, if no one's telling you or keeping you updated when you've got an already busy workload, those are the kinds of things that can fall by the wayside. So they were very much aware of the fact that they were on the back foot a little bit sometimes with parents, because they didn't know as much as they would like, and they would all welcome this additional training to make sure they can be much more proactive and confident in being able to approach parents who might be eligible for Healthy Start. And I just think, given that Healthy Start just as a scheme, because you don't automatically get it, because you need someone to tell you about it if you've not found out about it for yourself, then it's totally reliant really on that knowledge and awareness of those frontline staff. And all of the evidence that we've demonstrated here is pointed to significantly varying levels of awareness. So the importance of the city developing a much more comprehensive approach to workforce development around Healthy Start and the vitamin side of things is again another one of our key recommendations. So if we just move on to vitamins, this was, just the least well-known and least used element of the scheme by far. One report even stated around vitamins that they're literally hidden in plain sight. They're there, people should know about them, but they just seem to evade mothers and the staff who should be giving them out. So vitamins are hidden in plain sight. This is a fact that's reflected really in the extremely low take-up of vitamins, not just locally, but nationally. It's estimated nationally to be around 10%, but one report put it at less than 3%. And I think those figures would very much be reflected locally as well. The vast majority of parents and carers that we spoke to during visits to children's centres stated that they just did not use this element. And the move to digital hasn't helped that either, because there was a natural reminder with the paper vouchers, because you got your vouchers every 4 weeks. And if you were due vitamins, then it said you were due them. And if it wasn't your week, your cycle to get them, it had a line through that paper voucher that said void. Now on the digital scheme, there's no natural reminder that it's your 8 weeks are up and it's time to go and collect your vitamins. So that's a further thing that's going to impact upon what was already a really low base in terms of vitamin take-up. Very few of the people that we spoke to said, like I say, said they were making start of them. And one parent, these are quotes, said, "Can't be bothered with them. I eat healthy anyway." Another said, "Don't know anything about them." And another mentioned uncertainty around where to get them. And another said, "I thought they were just for babies." These comments, though, very much tie in with our findings amongst frontline professionals, who referenced how the vitamin elements of the scheme in Liverpool used to be much more successful when they were provided universally. So between 2014 and 2016, Liverpool offered vitamins universally. Overall, though, it was felt that there'd been a bit of a miscommunication just around the vitamin side of things, in terms of what vitamins, what for, with breastfeeding and all of those things, mixed messages really around that. And they wanted some clarity around that. And also they all agreed that the vitamin element just hadn't been promoted enough either. So if we just move on to our final kind of groupings around findings. So this is all coming down to marketing and communications. We visited a number of children's centres. I've said they were really passionate about the scheme, really wanting to support parents and families. Lots of them had literature they were giving out. They had posters up. Unfortunately, a lot of it was out of date. The digital card promotional literature wasn't really evident. The paper vouchers were still, the application form, the paper application form for many parents was still in the packs that were being given out. So this lack of any kind of strategic communication plan, I think, also added to everything else we've talked about, directly affected awareness and knowledge of the scheme within the city. So underpinning all of our recommendations we've made in this report, I think the development of this improved marketing and communications is also another key one, because we know that promotion at this more local level has been incredibly useful in a number of best practice sites. So a more coordinated approach, I think, to marketing and communications is also going to be needed. So there are key findings. So if I just move on to some of our recommendations now, we split these really into national and local. Nationally, we thought there was a need to review the eligibility threshold. I mean, it's estimated currently in the UK, there's about 500,000 people who are eligible. That's a 30% reduction in number of eligible beneficiaries since 2011. So that decline, is likely due, I suppose, to a number of factors. One of them being that the maximum annual income that Healthy Start participants can earn has not changed since 2009. Despite there having been increases in minimum wage and the introduction of a national minimum wage and all of these different things. So it's no wonder really that those number of eligible participants has started to decrease because of that, because that hasn't increased in line with anything else. What this has only done then is serve to push more families out of eligibility for Healthy Start, reflected in the decline in numbers, despite many families' financial circumstances either not changing or worsening as a result of price increases and rising housing costs, for example. So we've done a little bit, and we put it in our report that just said that all of this threshold is best demonstrated really by comparing how in today's money, that 16,000 maximum income would have been worth more like £23,000 in 2009. So we wanted to speak to the government around reviewing that eligibility threshold, because we're just pushing more and more people out of this. And I know that a lot of the frontline staff we spoke to who expected the parents they thought would have been eligible for Healthy Start, they were finding out that they weren't. And they were the ones, like I say, that they were really worried about, the ones they felt were more food insecure because they couldn't access any of these additional resources available as well. Locally, I think the key things there was we've already said about identifying a Healthy Start lead. We definitely need to engage much more effectively with GPs. The comment was made through one of the focus groups around, for a lot of women, going to the GP is the first person you go to when you find out that you're pregnant. And that's at a point when, before baby's born or anything like that, when maybe messages around Healthy Start might get through and might land. So we definitely needed to do a bit more there. We also need to engage more effectively with midwives and bring them into that steering group that we were talking about, and identifying a lead midwife, again, because of the contacts that they have. We thought that social care assessments, early help assessments would again just be another opportunity potentially to just talk about Healthy Start for some of those families that may have missed some of the other opportunities through other people. And we wanted to maximise community-based support, so particularly bringing health visitors and children's centres together as well. So if we just move on to the next slide. Training and workforce development, again, we know we need to do much more around that. We want to deliver and roll out a programme across the city. We want to produce a set of Liverpoolised frequently asked questions, because again, there's just a lot of misinformation, miscommunication around some of this. We need to better engage with the private, voluntary and independent childcare sector, because they'll be offering 2-year funded places as well. So sometimes they don't get included in a lot of the things that we're doing. So we need to make sure we bring them in, and we need to identify Healthy Start champions across all sectors. For vitamins, we do need to get better at monitoring the vitamin uptake. Children's centres were reporting that the take-up was incredibly low. Some health visitors referenced that for some people, because children's centres are the main place you can access, securing the vitamins, that's a bit of a barrier, because not everyone goes to a children's centre. Health visitors also at one point used to give out vitamins when they were universal. So there was discussions around whether that was a potential to do that again. And I know there was a bit of an issue around whether they were a medicine or a food supplement. But my understanding is from 2018, 2019, Healthy Start vitamins were reformulated and classified as a food supplement. So there was no longer any restrictions on who could give them out. But we definitely need to get better on monitoring usage and uptake. And then finally, for the marketing and communications, just everything we've said really around developing a marketing and communications plan and embedding Healthy Start into those wider contacts and websites. I mean, just for example, I was on a meeting last week with people who were working to develop the Live Well directory and amend that. And they, you know, I talked about Healthy Start, and within an hour, Healthy Start was put onto their website. So there are opportunities for us to improve across partner agencies, then being able to promote and access you know, a Healthy Start. And I think that might be me done. Is it? Yes. So that's it. Thank you.
Thank you, Rachel. We've had loads of questions in the chat, some of which have been able to be answered, others of which you and I will have a go at answering more formally. But firstly, I'd really like to say thank you to Rachel for all the time and effort she has spent. She has been a real trooper on this, going out to children's centres again and again, designing questionnaires, writing up transcripts, and obviously producing this brilliant report. So thank you, Rachel, for your passion, and it will make a real difference to not only our city, but we hope far beyond. Before we ask some of the questions, I'd like to bring in Dr. Bryony Kendall, who's on the call, who's just going to say a little bit about the citizens' advice and how they can kind of support with Healthy Start in Liverpool. So Bryony, and Alison's there as well.
Yeah, so in the room, so I'm Bryony Kendall, I'm a GP, and I've got Claire Marnie and Alison Williams, who's so we're all part of NHS Liverpool Place, which is part of NHS Cheshire and Merseyside, and so we're obviously very interested in this. And I was just going to say the engaging with GPs, I think this is an opportunity. There is already social prescribing in general practice, and I think that's something to emphasise, to reinforce that, with social prescribing and the link workers and the citizens' advice who will help with benefits. There's something about making every contact count. That's crucial in health in general, and we've just been thinking about all the different ways. So yes, people do often try and contact the surgery when they're pregnant, but also a lot of women self-refer to a local trust, or the Women's or Wiston or Ormskirk, and to say that they're pregnant. But there are points of contact where this is to come up and to prompt, and I would say actually this is an opportunity to put that inside the whole thing. Did you know within social prescribing that includes health, food? And if we had a sort of I love the Liverpool FAQs that we could incorporate that, and there are bulletins that go out to all GPs, and that's the kind of thing to go, did you know this is included? So we're not asking you to do it, but we're looking at for you to signpost people towards it and get it right for the women. And then also if they've managed to slip through the net in pregnancy, and I appreciate the health visitors trying repeatedly, but you're given so much information when you've had a baby, and that's when you're trying to take it in when there's no capacity in your brain to do so. There's also the 6-week check that people come into the surgery as well. So I think that's another further opportunity, 6-week check for the mother and the baby. So you're in with the GP for quite some time there. And that's another point where we need to sort of encourage GPs to be aware of it. I suspect the awareness is pretty low. I suspect there's some frontline practitioners who are all about this and really evangelistic and are trying really, really hard. And other people, it's just not on their radar at all. Do either of you want to say?
So can I say a little bit about we have a project which is about called the Best for Baby 2 network, which is about trying to reduce hardship connected to social deprivation in women who are pregnant and during the first year, particularly of their baby's life. And the reason for that was that the NHS Liverpool commissioned citizens' advice to provide a social welfare service for all patients. And when we reviewed the data, the referrals from primary care were not for mothers and children. So what we recognised was that actually the service was very effective in relation to some types of referrals, but it wasn't, referrals weren't coming through primary care for pregnant women and for mothers with very young children. And the reason is, as Bryony says, is because they become part of the maternity system. So we realised that we had to work differently in order to access those mothers and babies during the first year of life. And so the Best for Baby 2 network is a resource because it's got midwives, health visitors, mental health professionals, commissioners are involved in it, and we meet every 2 months as a group. We're now a network of about 80 people, that part of the work of the Best for Baby 2 collaborative is to try and improve or reduce social hardship through our networks and through developing different ways of working. And one of the things that we have identified, just to echo what Naomi has said, is that the booking appointment is potentially, well, the booking appointment is a really important appointment in terms of sharing information about resources that can reduce hardship, social hardship for mothers. And also we feel that there's more that can be done in primary care, as Naomi said, with the postnatal checkup and the 6-week checkup. So those would be the 3 touch points really where we've talked about, can we do something? Can we introduce a universal ask where there's just a check-in and an offer made to the mother to see whether or not she would like to take up the service which is commissioned for patients provided by Citizens Advice. Somebody's put a question in the chat box about social prescribing. So there are social prescribers in primary care as well. Citizens Advice is a social welfare service. So it provides, so social prescribers would often refer into Citizens Advice, but health professionals can also refer directly into Citizens Advice on prescription. So it's specifically for patients, and it's a different sort of process. People are seen within 2 working days, or they would be seen on the same day if the health professional flagged up that it was urgent. For example, if they had no food, or their heating had been, they had no heating or no food that day, then that health professional could just put in some free text. Otherwise, they just need to pass on the name and the contact details, and Citizens Advice on prescription will do the rest. I've probably said enough. Do you want to add anything?
Just a slightly separate topic, but obviously connected to all of this thinking, and there'll be colleagues on the call who are familiar with this emerging agenda around family hubs. And we've talked a lot about children's centres, which are clearly going to be a key component of the delivery model and the source for advice and provision and so on. But the family hubs are going to give us an even bigger opportunity, I think, to co-locate services and service offers, and to coach and get the comms kind of much better in place for those frontline staff, where they have that first contact with a family, with a mum and a new baby, and to start to kind of bring those conversations together in a much broader way, because the family hubs are going to have a much bigger reach and a much bigger opportunity for all of our services to knit together at that kind of early stage. So I think if we can start to think about the language of family hubs as opposed to children's centres, I think in the next few months that's going to be a really big ticket for a lot of those conversations.
Thank you, everyone. I think that's been really valuable, and I know loads of people on the call have kind of been messaging saying they've been learned a lot through that. I think that was really worthwhile. I know myself, at that booking in appointment, you're overwhelmed with information, so the more points we can just remind families about this, encourage them to apply, support them to apply, the better. Now, Rachel, we've had quite a few questions, some of which I've tried to answer in the chat, but one I wanted to put to you, there's a question about, do we know the profile of women and families who are missing out on Healthy Start? And also, do we know about the satisfaction levels of parents who are kind of already on the scheme?
Yeah, no, there isn't any information around profile, and I think that was one of the things we put in the full report, was asking around children's centres or nationally that, you know, we need more information, because you literally just get a spreadsheet that tells you so many are eligible and so many have taken it up, but you get no more information than that. So there's nothing around, is it, you know, people from Black and minority ethnic communities, are they the ones who aren't taking it up, or is it other particular groups of people? So there's nothing else to it, there's no context. So that is something that we might need to explore a little bit more, and I don't know whether that could be something through these family hubs and children's centres that we might be able to do, even if it's locally, but I haven't really got the answer to that.
I know we put it at the end of that full report, didn't we? It's kind of further research. So if you're an academic sitting on this call and you'd like a further research topic, we would say this is really important to know, are there particular groups who are routinely missing out? Sadly, we don't have the funding to kind of continue that kind of extent of research, but love to partner with you if you're an academic who would like to do that with us. Rachel, we asked in our questionnaires a little bit about satisfaction levels. Now, obviously, it wasn't statistically significant. No. We didn't, speak to thousands of women across the city, but what was the feelings you got from parents when you spoke to them?
I mean, I think people were really quite happy with the scheme. There were very few issues. I spoke to one person who had a really terrible time nationally trying to get hold, and that, I mean, that's an issue nationally. The website and the resources were used very, very much really by, well, parents and carers and frontline professionals, but parents and carers struggled. If they needed to contact anyone from Healthy Start, then it takes ages. If you go on the Healthy Start Facebook page, then you'll see that's a quite devastating effects, really. Some of the comments that parents have been putting on there around being unable, they've been waiting since December, quite a number of horror stories, really. But on the whole, when people were in the system and were getting the Healthy Start, they were really happy with it. They were much happier with the move to digital because it did reduce the stigma, and they felt like it was less of an issue now going to do the shopping. And because one parent mentioned when it was the paper vouchers, that one shop in Liverpool was charging them to use the paper vouchers. So that's kind of gone now as well. So, some of those abuses that maybe some shopkeepers were using. So, yeah, on the whole, I think people were really welcoming into the scheme, but there were a lot of people that I did speak to in children's centres who weren't eligible for it, who were struggling.
Yeah, and there's some of the families we're really concerned about at the moment, that people who are just above maybe that threshold for free school meals or for Healthy Start, but are kind of well below the breadline at the moment. Rachel, what kind of a personal question, due to your extent of this research, who do you think is best placed to lead Healthy Start in the city? What kind of department do you think that should sit on? And are we imagining a creation of a whole new role, or could it be part of someone's existing role? That's one of the questions.
I mean, to be honest, I don't really care. It doesn't really matter. I think it would be useful if it's someone who, is good at partnership work, and I think whose maybe role is a bit more front facing and does that partnership work naturally as part of the job. But whether it sits in public health or the council or a children's centre, I don't really know. But I think, someone who's got that partnership, those skills to be able to pull people together and generate that kind of commitment to the scheme, which I don't think will be hard. I think people are really keen to do more. They just don't know how to do more, and that's where that coordination comes from. I've forgotten what the other bit of your question was.
No, that's great. So whether we thought we needed a whole new role, I mean, from my perspective, and the conversations we've been having, obviously, with public health colleagues, children's centre colleagues, is that there is a lot of appetite for a working group. And that working group, we hope, will help establish who's going to have it kind of on their job description, just kind of lead to kind of take some of those recommendations forward. From Feeding Liverpool's perspective, we're very happy to coordinate the first few meetings of that group and bring people together, but we're probably not best placed to be the people who lead it forward for the years to come. So really excited to get that group started. We'll give you a little break, Rachel, because we're going to hear from a couple of kind of key partners from the scheme. So we've had 2 videos sent in, because both apologies that they weren't able to join us today. So the first is from Andrew Forsey, who's the director of Feeding Britain. Now, Feeding Britain are a national charity who do a lot of lobbying around issues concerning food insecurity, and Feeding Britain, alongside Sustain, another national charity, done a lot of work around Healthy Start and what could be done nationally to improve the scheme. So we're going to hear from Andrew. He's sat and diligently read the whole of the long report, and he's going to share his reflections via the wonders of a video. Thanks, Jen.
Good morning, everyone. Whilst I'm sorry not to be with you for today's discussion, that doesn't take away at all from the admiration and the awe that I felt when reading through the Healthy Start for Liverpool report. And so above all else, I'd like to congratulate Rachel and Naomi on producing such a valuable resource for the city itself, as well as other parts of Merseyside and indeed the whole country. One of the privileges that we have as a Feeding Britain network is to draw upon those outstanding examples of innovation, creativity, and above all else effectiveness at a local level as a means of initiating some much needed broader shifts and changes across the whole country. Already there are partners within the Feeding Britain network who are set to use the Healthy Start for Liverpool report as a blueprint for maximising take up in their area, and indeed will be encouraging as many others as possible to do so. But among the lessons that we've picked up at Feeding Britain over the years, and as the report itself identifies, it's that no matter how unbelievably hard we try to work at a local and regional level to boost take up of this vital scheme, we're in desperate need of additional support and reform from central government if take up is to be maximised in full, and that every child and family who stands to benefit from Healthy Start really does so. That's why over these past couple of weeks, MPs in the House of Commons and peers in the House of Lords have, through a series of debates and questions, undertaken 6 actions on our behalf. First, they have been pushing the government to adopt our proposal for automatic registration, which would shift the whole basis of registering for Healthy Start away from opt-in and towards opt-out. Secondly, they've shared the concerns that we began reporting on in February around some of the difficulties and injustices arising through the transition from vouchers to prepaid cards, and which needs to be resolved fully. Thirdly, they have kept up the pressure on the government to resume the monthly publication of take-up data, which has been suspended for the past 6 months. Fourth, they've made the case for expanding eligibility for the Healthy Start scheme. Fifth, they've been making the case also for much needed changes to the scheme in respect of how it works for families with no recourse to public funds. And sixth, as we speak, they're currently scoping a piece of legislation from the backbenches that would make it a duty for the Secretary of State for Health and Social Care to achieve full take-up of the scheme, mainly through the introduction of that process of automatic registration that I mentioned earlier. And so it's that threefold combination of workable ideas and practical action at a grassroots level, with determined and focused coordination within and across local authority areas, and those attempts to pull the right levers at a national level, which really does give us some hope of delivering on the Healthy Start for Liverpool report. And as always, you can count on us at Feeding Britain for our full support on those 3 fronts as we begin that important job now of implementing this incredibly powerful document.
It's great to have that message of support from Andrew, but also hear about those practical actions that our MPs have been taking in Parliament. So last week we had Kate Green and Ian Byrne both speak out on Healthy Start as part of a parliamentary session. And in some of the materials we'll send you afterwards, which will include all these presentations and a recording of the discussion, we can also send you a link to some of what's been going on in Parliament. I think Gentian's posted a little bit more about Feeding Britain, so if you're able and want to stay kind of abreast of that national conversation, I'd recommend have a look at their social media and their website. And similarly, Sustain has a whole section about Healthy Start with a really useful toolkit for other food alliances on the call who are kind of looking to get engaged in this work. Next, we're going to hear from Melissa Campbell. Melissa sent us a short video. She's a senior consultant in public health, explaining how public health are going to respond to the recommendations, which many of their teams have been involved in the kind of co-creation of this report. So it hasn't come kind of blindsided them in any way, but it's going to be great to hear from Melissa about what they're going to be doing in the kind of next few months.
Hi Hi, I'm Melissa Campbell. I'm a consultant in public health at Liverpool City Council. I lead for children and young people and communities, including food, nutrition and healthy weight. I co-chaired the Liverpool Good Food Task Force group, which drove and saw the creation of Liverpool's Good Food Plan, and I'm delighted to participate in this event to share and support the recommendations of Liverpool's Healthy Start review. Because we have long known the challenges around food insecurity in Liverpool. 1 in 3 adults are food insecure, half of our adult population are not eating enough fruit and vegetables to benefit their health, and really sadly 1 in 3 of our children are living in poverty, which makes them vulnerable to food insecurity. So it's absolutely vital that every eligible person is supported to access this scheme. The Healthy Start scheme is designed, nationally delivered, in order to support low-income families to access healthier food options. It targets families with children under the age of 4 years of age, because we know that the early years, including the first 1001 days, are critical for our cognitive and physical development. And so we know that children who start life with poor diets are more likely to grow into adults with poor diets, and they're also at greater risk throughout their lifetime of developing chronic illnesses. With this knowledge in our back pocket, it's absolutely unacceptable that we have over £750,000 worth of vouchers being returned within our year. This report goes to show us some of the challenges that we face in our local systems through liaising and discussing with frontline staff who are trying to deliver this scheme. And there are plenty of areas that we can work as a system to address. And as such, Public Health welcomes these findings and recommendations, and we are committed to seeing them implemented. The key thing that we need to do as a system is work together to address them and recognise our own contribution to promoting, supporting families' access and delivering this scheme locally. We can do this by establishing a multi-agency task group to assess and to translate these recommendations into practical steps that we can take to address these challenges. This should cover workforce development, communications, quality assurance, systems for us to monitor how we're delivering and potential gaps that we need to address on an ongoing basis, and a place that we can share good practice. Thank you for the opportunity for me to be able to respond to this report, and we look forward to working with you to implement these recommendations soon.
Great to hear from Melissa and have such kind of strong support from public health in taking this forward. We know from some of the best practice examples listed in the longer report that in other areas where they have working groups, it's really important that you have good cross-sector kind of representation on them. So yeah, delighted to have the support from public health. Now, finally, but definitely not least, we're going to bring in Debbie McAndrew. Debbie's the strategic lead for Liverpool City Council's Children's Centres, and very grateful, Debbie, for your time, but also all the staff time and parents in your children's centres for hosting us over the last few months so graciously. So over to you, Debbie.
Hi, thanks Naomi, and thanks for inviting me. My name's Debbie McAndrew, and I'm here on behalf of all of Liverpool Children's Centres to pledge our full support and endorsement of the recommendations of the report. We are all committed across all our centres to be fully involved in taking these recommendations forward. We know the importance of Healthy Start take-up and how that's vital for child development. So I'm just going to talk about how our children's centres are going to support this going forward in Liverpool. We've got really strong partnerships with many agencies, particularly our health visitor colleagues, and we are going to build on these to maximise the take-up of Healthy Start in our community-based support, particularly amongst our baby services. We're going to work with our private and voluntary sectors. Many 2-year-olds who access the early funding don't have take up the Healthy Start entitlement, so we'll actively share our promotional materials across all the PVI settings within our footprints. We're happy to hear that the GPs are going to be involved in promoting the scheme to pregnant women, And again, we'll continue to pass that message through all of our antenatal services. We are particularly keen to be involved in the working group and to help identify and develop the role of a Healthy Start lead, so we can create a really local approach across our children's centre footprints. All of our neighbourhoods are very different, and to be able to offer a localised push on Healthy Start take-up is really exciting for us. Being able to identify a single point of contact for those difficult cases, those complex cases, will be really helpful. We know it's difficult navigating the registration for Healthy Start. The Children's Centre use a database called eStart, where we record when families come in to collect vitamins. We can provide reports that are on a ward level or an LSOA level, so we can then really target where we need to push and use our social media platforms, both at a centre level, as city council level, to really target and push the take up across the city. The centres have got really active and very engaged social media, Instagram and Facebook pages, and again, we'll share all those messages consistently across and pass those messages to our PVI settings so they can include them in their correspondence with their families. We know the benefit to families from accessing the Healthy Start vouchers. We also know the additional benefit families can get from accessing children's centre services. So hopefully together, pushing the Healthy Start agenda and then supporting and encouraging families to take up the full wraparound offer of children's centre services, from antenatal, school readiness, speech and language support, healthy eating advice, employability. We can all work together to give our children the very best start. Thank you.
Thanks, Debbie, and for all your team already does to promote Healthy Start. It's great to be working together just to try and reach some of those families who are missing out at the moment. My colleague Jensen's going to post some links in the chat about this training that we're going to be rerunning. So it's a repeat of the training we did with the voluntary sector in May. It's going to be in October and one session in November. This is do particularly encourage people who are new to Healthy Start, but maybe could be signposts for families who maybe don't know about the scheme, or someone who needs a bit of a refresher. So if you're kind of unsure about that switch to digital that we've kept referring to, or whether people with no recourse to public funds can access the scheme, do come along to that training. We'd be delighted to have you there. One's going to be in person and one online. There's also a whole toolkit from the NHS with resources you can download for your own settings. So posters you can print out, easy read booklets that you can get printed to support people maybe with lower levels of the English language to understand about the scheme. There's stickers, there's all kinds, pop-up banners, the lot that the NHS have produced as a kind of library resource kit. So I'd really encourage your organisation to use that. Oh, I can see Bryony's got a hand up. Yes.
It was just to say that we just kind of don't want to raise expectations too much about health practitioners being able to do all of this, but we really want them to recognise and signpost on, as with so many things, to even to see the issue and refer on, so to social prescribing, to social welfare, to link with everybody else. I think I'm starting with the base recognition is very, very low, so just starting with that, I'm thinking about how I can get that information out to the health providers. I'm speaking about general practice, but midwifery, and certainly this is something that the Best for Baby 2 collaborative will be looking at very closely, because we've already got a group of people in the room there working with the same population, so it's something to work with there. But yeah, so we wouldn't necessarily be doing it all, but certainly signposting to the right people to do it, who have that expertise and that legal literacy and the general anti-poverty focus that we have, just to sort of, I'm really thrilled, and I think it's been a hugely successful and powerful presentation to start the day, and we've certainly got lots of actions to go away with, so we're on board. Thank you.
Just to add to that, when we've consulted with health professionals, they often tell us that they feel that they don't have the time to navigate systems that they're not familiar with. So that's why we've introduced, if you like, intermediaries like social prescribers and social welfare. In this case, citizens' advice on prescription do the social welfare bit. So they will take that and they will support the person to make the application and send them the reminders and help them navigate the system, which then takes the pressure off the health professional, which is that's the place we're trying to get to. But what the health professional has to do, as Bryony says, is kind of be alert to signs of distress and hardship. But also, one of the other barriers that has come up in discussions in the Best for Baby network is that people often think that somebody else has dealt with it. So it's not that people don't see it. It's not that frontline health staff don't see the issue. They just think that that's been dealt with somewhere else. And that's why we need clearer messaging about, when the priority times are to screen for things like social hardship. Because when do we expect health professionals to do that? Particularly during the pregnancy and the early years of a child's life. I've not seen anything that really clearly messages that for frontline staff.
I think that would be an important thing, to develop a kind of resource that helps remind people what are the key points that should be asking and screening for this, rather than thinking it's all been done at that kind of 8-week pregnancy visit potentially. I know kind of Rachel and her findings found that it was important that people are reminded again and again about
especially,
healthy start.
I think especially if you have to reapply once you've had the baby, it needs to be reinforced, and I think that's I'm thinking that's almost criminal. But actually, that whole thing, sorry, I think that's horrific that you have to redo that. So there definitely needs to be. Don't assume that someone else has done it, and even if they have done it, you might need to be reminded and supported to do it again.
And if you hear of people who say, oh, I used to get Healthy Start, I used to get these vouchers, they might not realise they needed to reapply to get on the digital system. From the Guardian report, it was about 50,000, hadn't transitioned over. So do keep reminding people, speaking to people about this. In Rachel's report, you can see that in Brighton and Hove, there's a receptionist who was just very faithful at Children's Centre of talking about Healthy Start and promoting it, and that kind of little area did have an uptake in numbers of people who were eligible uptaking Healthy Start. So any individual can make a real significant difference in this. Rachel, I'd like to give you the opportunity to kind of have a final words before I can tell people about the survey and things to fill out. So is there anything else you'd like to share about?
No, I think we've kind of covered everything. I just think the point around the fact, the barriers really, a lot of them are national. The fact that you might have been on Healthy Start for like 2 years on the paper vouchers and then they made you reapply to go on the digital ones is just criminal as well. The fact that didn't happen automatically. So we know a lot of people have fallen off, the fact that it isn't given out automatically in itself, and so the presentation, the video we had before around, you should opt out of this. It shouldn't be something that you've got to find out about at a time when, I haven't got children, I've got 2 dogs, but I'm sure if you've just had a baby, and a lot of the children's centre staff said, it's not called labour for nothing, was one of the quotes that I had. People are all over the place at this point, and we're trying to tell them about something really important and it's just not landing. And it's because we shouldn't have to be telling them about it. They should automatically be getting put on it. So I think nationally, hopefully, a lot of that uptake, the issues around uptake will be dealt with there, but I think there is still a lot more we can do locally just to encourage people as well.
Yeah, thank you, Rachel. I think this piece of work has given us plenty to be getting on with over the next few months and years in Liverpool, but hopefully some of that challenge nationally will also be taken to improve the system at a time when we really need families to be able to access this smoothly and be able to kind of ring fence part of their kind of budgets for good food. Just want to quickly say a few thank yous. Thank you so much to my colleagues Genshin and Jen, who have supported behind the scenes with all the technology that's been needed for today's session. Thanks to Annette James, one of our trustees here, who's kind of led some of our Healthy Start training and will be leading the training again in the next couple of months. And thanks to everybody who's contributed. There's been such wisdom in the room. If you're someone who's maybe got a link of a piece of information that you've shared or an extra report that you'd like others on the call to see, please do send it to me. I'll post my email address in a minute. Please do send it to me this week, and then next week we'll send you out a bundle of kind of the resources we've collected together, but also a copy of this presentation. We'd really encourage you to share it widely with colleagues, and keep an eye on our website, sign up to our mailing list to find out what else we're doing around Healthy Start and other things around food, tackling food insecurity in Liverpool. Jensen's going to repost a short link to a survey. It's really quick, but it really helps us. We're a charity. It's important we understand kind of the value of doing events such as this, but also what we could do differently, what we could do different next time. So I want to thank everyone for giving up the first hour of your day. And yeah, thank you, Rachel, for sharing what you've learned. Thanks, everyone.